I'm going to talk about hypertensive urgency and emergency today. Well, we had a 57-year-old male. He came to the ER with worsening headache and confusion, numbness and weakness involving right side of the body with a bit of blurring of vision for the last 12 hours. On examination, his pulse was 84 per minute. It was regular. BP was 230 by 130. Room air sats were 94%. He was confused a bit. He had a mild motor weakness of 4 by 5 in the right arm. It was a known case of hypertension and dyslipidemia on irregular treatment. Nothing in the abdomen we found. Other systemic physical examinations were within normal limits. He was admitted to the intensive care unit. Well, that brings us to what is the definition of hypertension. Well, you have a pre-hypertension in which the systolic blood pressure is between 120 to 139 and the diastolic blood pressure is 80 to 89. In hypertension, the systolic blood pressure should be more than 140 and the diastolic more than 90. And hypertensive crisis, it is divided into two: hypertensive urgency and hypertensive emergency. Urgency, when there is an acute rise in blood pressure with end organ damage, without end organ damage, and the diastolic blood pressure is more than 120. The only thing differentiating it from hypertensive emergency is in the hypertensive emergency there is end organ damage in addition to these blood pressure findings. Malignant hypertension is markedly elevated blood pressure and it is accompanied by grade 4 retinopathy, that is papillary edema. In accelerated hypertension, you have a grade 3 retinopathy, that means there is no papillary edema. What are the causes of hypertension? The commonest cause is essential hypertension, where we don't know what is the reason. Then renovascular disease, renal artery stenosis, which is not uncommon. And then can be other diseases like vasculitis, polyarteritis nodosa, Takayasu arthritis. Renal parenchymal diseases are very common: glomerular nephritis, interstitial nephritis, then multiple sclerosis, HUS, TTP, diabetes, SLE, and other renal carcinoma, etc. The relatively uncommon causes are endocrine diseases like pheochromocytoma, Cushing's, primary hyperaldosteronism, and renin-secreting tumors. Medications which can produce, there are many drugs which can produce this. Well, nowadays with the younger generation having easier access to these party drugs, so phencyclidine, cocaine, and these are all sympathomimetic amines, and they will increase the blood pressure.